Good afternoon, everyone. My name is Shannon Kupka. I'm a project manager working with the nursing home cohort from Health Insight, New Mexico, and I'd like to welcome you to our half-hour Hot Topics series. These webinars are designed to provide you great ideas on antipsychotic reduction strategies in a 30-minute time frame to accommodate your busy schedules. They're brought to you by your statewide Partnership to Improve Dementia Care work group and sponsored by the New Mexico Department of Health, New Mexico Healthcare Association, and Health Insight. A few housekeeping details before we start. Please take a moment to let us know who's on the webinar today by entering your name and the facility you represent in chat, as well as the name of any folks joining you. If you're listening in a group, please enter their names as well. Your cameras and microphones are muted. If you'd like to ask a question, please enter it in chat and we will facilitate a question and answer session at the end of the presentation. The New Mexico Healthcare Association has generously provided CEUs for administrators, nursing staff, and activity directors. To obtain these, please provide the name and email address of anyone interested in these from your group. You can enter this into chat, or you can send me attendees and their email addresses in an email follow-up after this session. And a follow-up email with a test link through the New Mexico Healthcare Association will be sent out early next week. So we are very excited about today's presenter. Our topic today is One Bite at a Time, How to Eat an Elephant and Reduce Your Antipsychotic Rates Too. And let me tell you a little bit about our presenter. Elaine Chavez is Project Manager for Health Insight. She's a registered nurse with a Bachelor of Science nursing degree from the University of Phoenix. Ms. Chavez brings 33 years of experience inclusive of Director of Nursing, upper-level clinical, and case management. Her extensive experience includes behavioral health, juvenile and adult corrections, long-term care, infection control, quality improvement, and Project ECHO hepatitis C corrections. She's provided invaluable knowledge and support for healthcare-associated infection and prevention to New Mexico hospitals, and under her guidance for a long-term care facility, the facility achieved a 5-star deficiency-free audit for 4 years. So, the reason why we have decided on this particular title is that there's no real magic wand you can wave to reduce your rates. It takes a good process in place. And so just like that joke of how do you eat an elephant one bite at a time, how do you reduce your antipsychotic rates one step at a time? So hopefully through the end of this presentation, we'll give you some successful processes to decrease the antipsychotic use in your facility, identify some strategies to engage team members at all levels in your antipsychotic reduction efforts, and we'll look at some small steps that your team can take to begin reducing your rates. So I will now turn things over to Elaine. And Elaine, would you mind just doing a quick sound check so we know if everyone can hear?
Good afternoon and welcome, everyone.
If you can hear Elaine, just do a quick chat and say yes, and that would help me, if everyone can hear. So it looks like we are a go. So let me switch over to our next slide, and Elaine, you may get started.
Thank you. Thank you, Shannon. And welcome once again. Some examples from a deficiency-free 5-star geriatric facility. Colfax General Long-Term Care was a facility I worked for 5 years. We're a very rural location, very few resources in Frontier, New Mexico. Trust me, there were many hats that we each wore. I specifically was the director of nursing. I handled MDSs. I did abstracts, care plans, and yes, I did work the floor. My assistant director at the time was also new to geriatrics, so we had so much work to do in a very little amount of time because we had the state auditors walking in 12 weeks. We were learning new processes. We had a Vista Keen system we were trying to figure out, and physician's orders that needed to be done in less than 3 days. So we had a lot of work to do. We had to develop a system for things to run smoothly. And I'm sure with all of you on today, you really understand and it's quite familiar to you, and that these challenges are very real and they can be very overwhelming. So my hope today is that we can prepare you with some processes to begin decreasing your antipsychotic use in your facilities. It's very important to have that sound process and effectively communicating with respect and compassion so the message that you're trying to get out can be heard and understood. Developing a team is key. It's very important to actively listen to your staff so there's a willingness to learn and grow in a highly regulated geriatric setting. The process of running a facility will become a priority when we all begin to understand what those priorities actually are. We need to seek to understand and then to prioritize and problem solve. The staff in your facility already know the problems and the needs. If you'll take the time to listen to them, it will really help you in your endeavor to start to decrease that antipsychotic use and taking that first bite out of that elephant. Next slide, please. The benefits of a process-driven outcome. It's important for us to understand, of course, that we need to decrease those antipsychotics because the directive coming from CMS says we will. Process is very important. These physicians are going to want to know why they have to suddenly start working on it even more aggressively than they've been trying to do. So it's very important for you to do your homework and start slowly and 1 or 2 patients at a time. Next slide, please. So as we think about antipsychotics, it's very important that your team, you yourself as directors and those of you on this call today, educate yourself about what antipsychotics are, what they do at your facility level, how they impact your other quality measures. Keep in mind that the antipsychotics were designed for serious mental illness. They block dopamine because it's very elevated in those people with mental health illnesses. So when we think about providing antipsychotics for those patients with dementia who are having behaviors that are more about they're having trouble with communicating their needs than actually having elevated dopamine levels in their brain. So what the dopamine starts to do is it actually decreases that resident's dopamine in their brain, which in turn decreases their balance, their memory, their mood. Obviously, when we have those areas that are being affected, this in turn will begin to actually affect your quality measures. When you start to see incontinence in your facilities, you're looking at some decubitus ulcers that are beginning to present themselves. They're having an increase in falls and memory loss. They may start having more use of antibiotics. They're going to the hospital, which we know for fecal impactions. Those things can directly or indirectly affect the antipsychotic use. So we as nurses that are on the call today, we know that a medication like Risperdal elevates the blood sugar, which is not helpful at all when we're talking about people experiencing metabolic syndrome. Next slide, please. So what do? Well, we first do our homework. It's very important to do our homework. We need to understand that, yes, CMS is providing that directive. So what are we going to do? Well, we better first think about reviewing your electronic medical record and seeing what patients are actually on antipsychotics that aren't necessarily having a psychotic diagnosis, a DSM-5 diagnosis. The other piece is to kind of take a peek at that facility level, your CASPER reports you're all familiar with, or we begin to be very familiar with that report. Looking at those doctor's orders and trending what doctors tend to use those antipsychotics more, because at one point in the work you do, that data is going to matter in terms of what you're going to be providing to your medical director and your pharmacist. Why are those medications being used, and why do we need to use those medicines? Those are some of the questions. Next slide, please. So let's take a peek here at what kind of data you can use to show your medical director, your prescribers about the rates and the data. And Shannon, I'll turn this over to you to provide some insight into this piece of the presentation today.
Sure, thanks, Elaine. So one piece of data that you might want to use to generate buy-in from your medical director and other prescribers is the quarterly data report that's provided to you by Health Insight. And if you can see, this is kind of a teeny version of it, but essentially we provide you basically a report that shows your composite scores. The Centers for Medicare and Medicaid Services measures us on our progress using a composite score of 13 of your long stay measures. And so right here in this particular line graph, you see this orange line is the state data showing that the state's rate is moving down a bit. This blue line is your individual facility data. And underneath this line graph here are a bunch of bubbles on a bubble graph that shows the proportion of which these 13 long stay measures might be driving your composite score. So if you could see my cursor on this particular report, this is a bit of an eye test for you, but you see 13 of your long stay measures listed on the bottom here. And you can see that the antipsychotic measure is actually driving your composite score because it's actually the highest proportion of your score. This is what's causing most of this top level line graph to be what it is. So these antipsychotics are really driving your overall score. On the next pages of your report, each measure is actually shown in an individual line graph. And again, you have your green line here, which is your national average of antipsychotic scores. Your orange line shows you the state rate. And this blue line shows that for this particular facility, their trend line is going upward, which is not necessarily what you want to see. In each of these particular areas, you want to keep dropping those scores. The last few pages of your report show how your composite score ranks you in comparison to other nursing homes in the state. This orange line is your facility score, and you could see that for this facility, they're kind of solidly in the middle of the pack in comparison to other nursing homes. However, there's another ranking page that's part of your report which shows you how your antipsychotic measure ranks in comparison to other nursing homes. So you can see that's actually negatively impacting this facility's score. It's ranking in the lower echelon of antipsychotic rates and dragging down the facility's overall performance. So this, in addition to your CASPER report and other internal measures that you have, may help you in generating a dialogue with your medical director and or other prescribers that you have. So back to Elaine.
Thank you, Shannon, for that data insight. One way to do process improvement, that is the whole purpose of us meeting today, is trying to assist you all, whether you're a new director of nursing or whether you've been there for a while, and really trying to figure out a way to at least decrease the antipsychotic use for one or two of your residents, which in turn we can decrease the statewide reduction goal of the CMS wanting that 15% reduction. So what do we want to do? Well, first, as I was going through this, I was thinking about the buy-in that we need to have, but I think we probably need to discuss first that buy-in that needs to take place with your administrator in your building, so they are educated and apprised of exactly what needs to be done and what your plan is to get that accomplished. So again, we begin your process by first reviewing those residents with that psychiatric diagnosis and on an antipsychotic drug. At that point, then you can consult with your medical director and let he or she know what your findings are. That allows for training of the attending physicians that will be assisting them. If you can get the buy-in from the medical director, which I know is a challenge, I've been there, it's very difficult to begin to talk to the medical director about more changes that need to occur in order to meet some statewide reductions that you need to have. And a little bit later, Shannon is going to provide you with some of the resources to guide you and your medical director with tools to begin the process of eliminating the off-label use of your antipsychotics. I would like to recommend, once she does provide you with those resources, that you print them. And any of you who know me out there know I love binders, and yes, I am a binder queen. But it does provide you with an at-your-fingertips look for your clinicians and for your medical director, so everybody understands why you're doing what you're doing. Get your care plan team on board, your leadership team, educate them about antipsychotics. That way there's a good understanding of what needs to be done. The next thing after you're able to get the doctor, the medical director on board, then you really need to get with your consultant pharmacist. Show him your results of how many people you have on antipsychotics that do not have the diagnosis required to actually decrease those reductions, and keep them on board and hold them accountable to assisting you with those decreasing those meds and some thoughts about what could be used, so you can provide that to your doctors as well. It's important to remember that we have to obtain orders from the resident's physician to get a psychiatric evaluation and to get some treatment options. At times it can be quite frustrating for the medical director, because they don't necessarily, especially when we're speaking about rural America, having them speak to a psychiatrist about a treatment modality that maybe they're not necessarily comfortable with, or that they're not real understanding of what is going on with that. Consult your providers, consistently provide updates to your staff on the progress. Educate, 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 and if you forget, educate. Educate your staff. Educate the residents, your multidisciplinary teams, and your families in the care plans about why we need to decrease antipsychotics. Educating about what that dopamine is doing for their loved one or for the patient is very helpful. We tend to forget sometimes really the chemical component of those antipsychotics. And then what you want to do is really look at your Casper data. Shannon was showing you the information that's available to you, so that you can see what's triggering your quality measures. And as we could see many times, it is the antipsychotic use. That Casper report does draw from the most recent MDS, so accurate data entry and the accuracy is very important. Next slide, please. Once you look at that, then you're going to start to talk about scheduling appointments for those residents to be seen by the psychiatrist, so that they in turn can be a source of consultation for that physician, because a physician will need to change meds, titrate them down, or discontinue the off-label use altogether, which is what our hope is. And then on a monthly basis, have your consultant pharmacist, or for those of you that have a pharmacist at all the time, have him analyze those antipsychotics and look at those diagnoses, so you can progress toward the goal of decreasing that antipsychotic use. And then provide results to your quality improvement team. I can't tell you how important it is for your quality improvement team to know what your goals are and what you're attempting to do and why. Next question. So what do we do? Well, let's focus. We have to focus on opportunity to improve, and we know what the focus is. It is actually trying to decrease that antipsychotic, those numbers in your facility. But you have to really organize your efforts. Stay focused and stay organized. Clarify each step of the process. So when we say clarify current understanding, it can be different for different people. So make sure you're clear about what you want to accomplish, and understand the causes of the variations that are occurring with why you're actually having antipsychotics. Do you have particular providers that are using more than others? Look at those trends and take a peek at that and provide the insight to your medical director so that he or she can also help you. Then you can select that strategy. And it works differently for different facilities. Facilities that have larger groups, it's a little bit easier. But if we're speaking to Frontier, New Mexico, where a psychiatrist is available only telephonically or doing telepsych, it's very different. So we have to make good use of our time and still continue to take that one bite out of that elephant that we're trying to do. Next slide, please. I think I've mentioned it once already, but if you didn't remember this, please do. We must always take personality out of the equation in order to get a process going. By that I mean that change is difficult. You have physicians who are not really willing to change, or they might be quite resistant to the change. They don't have the buy-in because they're already trying to deal with so many other regulations. So we have to understand that there's a resistance to change because once again something else is changing. But it's important to let them know that it's a CMS directive and that we have been charged to make those changes of the off-label use, and at the end of the day, most importantly, that it really affects those patients that we serve, and that's really what we're here for. We're talking to them about, here's the problem, this is how we do things, here's how we'd like to do things going forward, how can we work together so we can be successful. And it's really important to keep your word. Be persistent in working on the issues and share your results, because many times we get started with a process and we don't continue to do it. So if it's not important enough for you to consistently follow up, it's not going to be important for them to continue to try to work with you towards that common goal of decreasing that actual reduction you're looking for. Next, please. One bite at a time. One bite. Understand your root causes. There is no quick fix. There hasn't been a quick fix. I can tell you, when we first started looking, when I got the first letter from CMS that we were going to do these reductions, I had no idea what to do. It was very new. There weren't some of the resources that Shannon's going to speak to you about. So you really have to think about, there's not a quick fix. Where am I going to start? So start small. You know, decrease your percentage rate by the quarter and only do a few residents at a time, and start with the ones that have the most antipsychotics with the most issues that you're seeing across your quality measures, and begin there. Prioritize your goals and accomplish one at a time before you begin another. We are so busy trying to do so much that sometimes we don't finish one thing before we do start the other, and then we really can't see some light at the end. Pay attention to both your short and long-term antipsychotic rates. Look at those quarterly trends and see what you can do. Why are they increasing to the point where they are, and what can you do to take those down? Be accountable to your team. Let them know that they are important, and that you're going to continue to follow up and do the best job you can for those residents that you serve. So don't let up. Next slide, please. So what alternatives are you putting in place? Those providers are going to want to know about those early morning calls and how they're going to be handled. So it's very important to start building that trust, and that will encourage them to reduce medications. Be consistent, keep communicating with those providers, and maintain that trust and cooperation. By doing that also, you have some resident preferences. Look to see what those residents actually like to do, what you can do to change what they might be doing, and address activities in a way that you provide those activities specific to those patients, and not really do a cookie cutter kind of care plan that you tend to see when you have larger number of patients. The doctor needs to know that if it's not the medication, then what? Be prepared to answer the then what. So we have some tools, and back when we started with this, we really didn't have a lot of these resources. So I would really encourage you to have those resources and use these resources instead of trying to reinvent a wheel, because they're really wonderful resources for you. Shannon, would you please review some of those resources for those on this call today?
Sure, I'm happy to. I wanted to just walk you through a couple of go-tos for resources. The first being the Health Insight webpage, if you haven't visited that yet. When you click on the Health Insight link, it brings you to a home page, and you'll see that for folks who are part of our nursing home collaborative, there's information on the collaborative learning activities and learning sessions that we've done on a quarterly basis. But there's a little section here called Nursing Home Resources. And clicking on that will take you to a page that has a lot of drop downs when it comes to QAPI, quality measures. I just wanted to orient you a tiny bit. There's some promising practices to address specific concerns with links to different materials. So things like our key areas, fall prevention, incontinence, infection control, are all on here. If you scroll down, again, you'll see a number of different areas, and there's a special tab specifically for antipsychotics. And on this page, you'll again find links to different resources. Our Oregon colleagues put together a very nice little antipsychotic reduction toolkit with scenarios that you can download for in-service training, with a little basically tiny pocket guide to behavioral needs that can actually be attached to a lanyard or stuck in a med cart somewhere for folks to refer to. And of course, our half-hour hot topics, you can find them all here on this webpage. So if you've missed something and want to go back and take a look at them, this is where they all live. So that's just a couple of resources that we have just right ahead on the Health Insight page. And one of my favorite go-to places is the National Nursing Home Quality Improvement Campaign, formerly known as Advancing Excellence. So here you'll see there's a lot of different tabs for various resources. And Elaine talked about providing your physicians with alternatives. And here they have a little section here called the Physicians Package, which has links to various tools and forms, clinical practice guides. And we just wanted to show you one or two of these really quickly. So there's a very, if you don't have these, some people have their own internal tools and resources, but if you didn't have something like this, a nice form for tracking patients at risk and looking at antipsychotic medication reduction behaviors, et cetera. Going back to this physician section, here's a nice example letter for your medical director or other prescribers, which talks about what it is that you're trying to do to get their buy-in, looking at the OIG report, which talks about adverse events. You can take this and customize it for your needs. Also in handouts and tools, there's a nice little resident prioritization algorithm that you could use as a team to determine who might be those residents that you would want to start with first. So it helps you organize yourself. There's another great tool on eliminating off-label use of antipsychotics. So if you scroll down, there's an entire booklet with some easy steps that you can get started with that helps you just organize as a team with what you're going to do to start reducing antipsychotic use. And then a lot of folks have received a giant binder at one point of the hand-in-hand training, but somewhere it's moved into someone's office or left the building or whatnot. So here's where you can actually go and download the hand-in-hand training series for nursing homes. So if you have some folks that are just learning how to work with individuals with dementia, you have all of this information, all of the modules right here online for you and an instructor guide. And if anybody wants a more in-depth walkthrough after this session, please reach out to me. I'll be more than happy to walk you through these resources and others. But this is just a good place to start. And please let us know if any of you have used these resources. We like to kind of hear what your experiences are. So back to Elaine.
Yes, thank you, Shannon. And yes, I really wish I had had even half of these resources when we initiated the antipsychotic decreasing in our facility. So I really do encourage you to use those so you use more of your valuable time towards reaching the goal than trying to find a resource. Set a benchmark. And don't forget to celebrate your successes. I would host luncheons, ice cream socials, treat bags to reward successes, even the very small ones. Start on 1 to 2 in your facility, and you can actually help our entire state as we reach towards getting that antipsychotic reductions in place. Thank you so much. And do we have any questions?
Yeah. Again, Elaine's really worked in the trenches, so that's why we wanted to have her present to all of you to share her experiences and to answer a couple of ideas of, you know, maybe some things that you're struggling with that she can give you her go-to. So do we have any questions for Elaine today? Or does anybody want to ask Elaine maybe? Oh, Casey says, we love you, Elaine.
Thank you. Yes.
Great. We didn't even pay her to say that, Elaine. So
Thank you. Yes.
So if you could think of something afterward, please reach out to us. This is why we're here, again, to support your efforts, to help you just, you know, not feel like you're on your island. We're all working on this together. We're all in this together. So the presentation that we have here is going to be posted to our website in a couple of weeks. And again, I encourage you to check out all of our posted webinars here on our nursing home library. And please share with your colleagues who couldn't attend or think of using these in chunks or as a whole in order to in-service your staff. So we are going to have another hot topic coming up in 2 weeks on working with your medical director by Dr. David Scrace from UNM. We're very excited to have him. But I want to take this opportunity to say thank you to Elaine Chavez for your willingness to present to our group, and also your willingness to be available afterward if folks have questions. We really appreciate you sharing this information with us and your process.
Thank you. You're very welcome. It was my pleasure.
Thank you. Okay. So with that, I'm going to let you all get back to your Friday. Have a wonderful weekend, and we look forward to seeing you at our next Hot Topics. Take care.